Well, hello, everyone. I just wanted to uh, tell you that we are in for the stretch run of the battle for the state of Virginia and also for the Republic, because as of, at least for Virginia, as of last week, the primaries have ended, the smoke has cleared, and now we have the final warriors. And speaking of warriors, I think like about almost 40, maybe 5 years ago, we had a special Splash of Tea series. It was a medical freedom series. And at the time, I couldn't believe I was using the word medical freedom because it just didn't make any sense that would be threatened. But luckily, we had a godsend by the name of Dr. Sheila Furey, who came and actually was just precious and priceless, because before she came along, we were feeling very lost because we didn't have the expertise and we didn't have the credibility. All we did was we had a feeling that something was wrong, that our constitutional rights, even our medical freedom, life and death issues, being able to visit our relatives on their dying bed, all of that had just exploded and we had nothing to say about it. And so many of our friends, neighbors, and families were going along with it. And all we had was that we had a feeling that this was wrong, that our constitutional rights was not at the beck and call of some kind of virus from China. So there's a big event coming along on the horizon, and that's why I was so tickled to death to be able to introduce to you, or reintroduce to you, Dr. Sheila Furey.
It's exciting to be back.
Yes.
And especially at this time.
Yeah, it's so interesting because, you go through history, you go through time, and there are crises that happen that seem to be just so consequential, and they are, but they're like minor little blips on the course of history. And then you have times where almost every single day, there's absolutely an explosion of history of consequential importance that actually is on the scale of good and evil. And you're right on that scale. You're looking right straight at that scale for at least half a decade or more.
It has been a road that we didn't think any of us would be traveling. And it's such a critical role to be able to educate the public about our medical system and how to advocate for yourself and your family and how to see the writing on the wall, to not fall to the propaganda that is given in the doctor's office, that's given in the ads on television, and to really teach you that you can be healthy without being controlled by the medical industrial complex.
There are people, a lot of well-meaning people, I could have been one of them, that would do some of the research, some of the reading on some of the exposés that are absolutely not heartbreaking, they're backbreaking, because this is America, and to think that such evil exists and prospers in this land it's just almost inconceivable. But I want to let the audience know, because some of them may not know, that it is always good to have someone in the medical field who knows what they're doing and who has met with other people of very high stature, what you know, and why you know it. So just give our friends watching just a brief overview of your background.
So I'm a physician, I'm a psychiatrist. I've been practicing for almost 30 years. And in the midst of COVID, I began to observe that what was demanded in the hospitals was not ethical. All right. So there were multiple levels. One, the massive shutdown we have never done in medical history. And the fact that we shut down our schools where the children were not at risk, where we shut down our churches, which has never been done. All right. And we have always relied on, as a nation, on the role of Christianity, the role of our faith, and how important it is in times of crisis. And we took that away from people, and it was a deliberate move to isolate people and increase the level of fear at a disease that was treatable. And we knew that it was, COVID-19 was treatable with repurposed medications, with high dose steroids. And we knew that very early. So by March, April, May, we had mechanisms to treat it, and these were being shut down. And by the end of the summer, we had plenty of evidence about the use of ivermectin and hydroxychloroquine. And again, this mechanism was shut down by the federal government because their answer was an untested, unproven vaccine, which was not really a vaccine, it was gene therapy. They actually had to change the name or the definition of vaccines because it didn't prevent you from getting the illness and it didn't prevent transmission of the illness. And yet they wanted this to be given worldwide. And it's really catastrophic what happened in the world, the effect and the death rate from the vaccine, as well as the death rate from those who were untreated in a treatable illness. And so, we had in our state, we were so blessed to have Dr. Paul Marik, who will be a keynote speaker at our summit on September 12th. But the work that he did then, and he continues to do, because after this, what we're seeing from the shot is an epidemic of cancer. And in my practice, I have never seen the degree of cancer that I am currently seeing. And it's really alarming because the patients are being diagnosed not at stage 1, not at stage 2, but almost every single one is diagnosed at stage 4.
Mm-hmm.
And this is really alarming. And so what Dr. Marik is looking at is the use of repurposed medications that can be used by themselves or in addition to chemotherapy and radiation, so that you're working together with the traditional oncology system, but you're working together to save lives. And the evidence is overwhelming of the benefit of these drugs as repurposed medications to help save lives. And so often when you're diagnosed at stage 4, all the medical system will offer you is palliative care. We're going to make you comfortable in the last months of your life. And now with the research of Dr. Paul Marik, with Dr. William Mackus, who's been doing this also, we have evidence that these people who were, put on palliative care have been offered alternative treatments and are now cancer-free.
Cool. Wow.
So when we have that kind of evidence and we have the average person in Virginia come and hear such wonderful, internationally renowned speakers, that is what we're all about. It's bringing to the average person the information from national experts who have been doing this, and not just for a couple of months. These are frontline doctors who have been working in this for years and have sacrificed all in order to provide and continue their mission to help people and to do no harm.
Well, that's a really good overview. And I know that 4 years ago, it was pretty dark because not only were your voices being silenced by social media, but the government was silencing you and using their ability to take away license to end careers. And this was happening without the backlash of the media exposing. In fact, the media was in on it. And so many of lives and careers were destroyed by these by government officials taking the directives from Mr. Science himself, Dr. Fauci.
Yes. Who pled the fifth 111 times. And I think in response to Dr. Fauci, we have Dr. Patrick Carawell, who is at Health and Human Services. And he has just produced an expose tracking all of the people involved, all of the people within Health and Human Services, the CDC, NIH, and the roles that they played, those that tried to stop what was going on, and those who changed and flipped and placed the entire nation at risk by changing the science to suit their agenda. And so it's really wonderful to have someone from HHS be a speaker, a keynote speaker at our event, who's going to be telling the truth, talking about, and you have the opportunity to speak to these people. So it's not people who are going to come and then leave. You have the opportunity to ask them questions, to look at the data, to have links to the data that they have created that gives you the facts that have been covered up all of these years.
Well, it's quite a difference, like night and day, literally, from Biden and Fauci to now Trump and Bobby Kennedy Jr.
Yes.
A lot of good stuff can be happening, and you won't have the heavy, powerful force of the bureaucracy crushing you to little bits like they were trying to do in under Biden's regime. So now I want to get to this monumental, it sounds like a huge conference that's coming up. So please give us the details, because this is something that's just not for medical professionals. This is for, it sounds like it's for everyone.
This truly is for everyone. And it's September 12th in Virginia Beach at the Founders Inn. All right, there is a full day of speakers. So the day begins with breakfast, and then our first speakers begin shortly after 8 o'clock, and it will go until 5 o'clock. There will be breaks, there will be vendors, and then in the evening, we have a gala dinner and dance. And we will be featuring Dr. Paul Marik in the evening session. But what we're really looking for is everyone to come. Maureen Diaz from the Weston A. Price Foundation is going to talk about your food and your diet and how incredibly important that is. We know the large number of people who have been injured by vaccines, and Dr. Daphne Kasparek is going to come and talk about vaccine injury. And that's not just limited to those who have been injured by the COVID-19 shots, but also other vaccines that people have suffered from. And she's also going to talk about long COVID. So those who didn't get a vaccine, but have been injured because they suffered dramatically from COVID-19 itself. And what can be done for you medically? Because many of the mainstream doctors continue to say there's nothing we can do. And that, in fact, is not the case. There are many interventions that are occurring, and people are recovering. The recovery remains slow for some of these people, but the fact that there is hope and that we can give them hope is really important. We have two vaccine experts. Dr. Bose Ravenel is a pediatrician with 50 years of experience. And this is really wonderful because he has, in his career, has been able to see before there were vaccine mandates to the childhood vaccine mandate schedule and where vaccines are at now. And he can testify. He's been an expert witness on the childhood vaccine schedule. And as we've seen the rate of autism go from 1 in 50,000 in 1960 to 1 in 20 African American boys, this is something that's really important. That rate is even higher in those of military. So when we look at the Virginia Beach, Hampton Roads area, and all of our military men and women there and their families, the rate of autism for those is even higher than 1 in 20. So we need to really speak directly to these families and educate them about the many, not only treatment interventions, make them knowledgeable about those, but how they themselves and their families can step away from the mandated childhood vaccine schedule. Dr. Steve Crowling, who was a whistleblower for Merck, is going to talk about the questions that every parent and every person should ask before they take any vaccine. So he was one of our speakers last year, and he was so good. We said, please come back and give us another round. So, really talking about how the pediatricians, the family practice are scaring you into having vaccines. All right. And if you don't have the childhood vaccine schedule, your child is at risk for death. He can give you the latest numbers that disprove that. In every single category, the risk of death from the vaccine is greater than the risk of death from the illness. So when we look at chickenpox, measles, mumps, rubella, the rate of death from the vaccine is actually higher than the rate from the baseline illness. And parents don't know this. And so we want to give them and arm them with the data that they need to make informed decisions when they go to the doctor. We want to talk to them about religious and medical exemptions. So, families that have a history of neurological disease, who have autoimmune or genetic diseases, what is the risk for their family in vaccines? And we have the experts there. We also have an expert in maternal-fetal medicine. So, one of the biggest crises that came out in the General Assembly and has been an issue for the General Assembly is the high rate of maternal fetal death, particularly in the African American community. And we have a maternal fetal specialist who's going to be able to talk to patients directly, their families, to discuss how you mitigate those risks and what you can do in order to protect both the mother and her unborn baby.
Is that like SIDS?
So this is before delivery. All right.
Okay.
So when you have high blood pressure, other symptoms that occur before the baby is delivered. So what can be done to decrease those risks during the pregnancy? And then we'll also absolutely look at SIDS, which is sudden infant death, which is directly linked to the childhood vaccine schedule. We also have Jeffrey Tucker from the Brownstone Institute. We are so blessed to have him. He's the president of the Brownstone Institute and has been a writer for the Epoch Times. And he's been looking at this really from a societal and a moral perspective of what we have faced in the United States and around the world. And his words of wisdom are really crucial.
Yeah, so he's going to be, I guess, looking through the broken lens, medical broken lens.
Yes.
What does that mean?
So it means that we used to assume that healthcare in our healthcare system was really advocating for the patient. And we know that lens is broken. That what we saw in COVID was advocating for the medical industrial complex and making sure that pharmaceutical companies were made their money. Okay, their billions of dollars, or if not trillions of dollars, during COVID-19 at the expense of the patient. So when we have low cost interventions, which is when we look at public health, one of the most important things in public health is how do we provide interventions that are low cost, that save lives. And we know this from history. One of the basic things is clean water and sanitation. All right. We know that washing our hands between seeing patients are one of the biggest things that help save lives. All right. And so this is where, when COVID started, we had people who were saying, look at vitamin D and the importance of having vitamin D. about breathing fresh air. All right. Opening the windows so that you have continually moving air so that you're not rebreathing the virus. So, very simple, low cost things that could be done. And yet, people were told either not to do that or to be afraid of that.
Mhm.
And so, having people all together to support and ask questions is really what we're about. Right. We also have a wonderful panel discussion led by Dr. James Kelly from Maryland with Chrisanna Shackelford, who is from the Department of Defense. She's retired DOD, and Kathy Hudgens, who's a retired ICU nurse. All right. They were going to talk about what is it like to be a patient and interface with the medical system. What are the things you need to know as the patient, and what do you need to know as a family advocate? And this became really important to me as I began to receive phone calls from people who said, my mother, my father is in the emergency room. They're in the ICU. I'm not getting the information I need from the doctors. How do I do that? How do I ask questions? What is the information I need to know? And so as we navigated that road, that's the reason we put this panel together. So how do we teach patients or their family members to talk to doctors and not settle for you? That's information you don't need to know. We're the doctor, we're telling you what's important. And every person needs to fully understand the risks, the benefits, and the alternatives. And the doctor has to be able to explain that to you. And if they can't make it understandable to you, somebody in the hospital system can. And that's why it's so important that you know how to ask for a patient advocate, how to get access to the patient chart so that you can review it and not simply accept what's, that you're given a medication and you didn't even know you were going to be given that medication.
Mhm. It's I was shocked at the level of compliance with major hospitals and doctors during the Chinese Wuhan virus, and it was just it's almost as if the system was bending. If you're a good doctor, we will bend you to our will, or we will take away your medical license. So it's that systemic control. China has it. Cuba
Mhm.
has it. I remember when I was in Cuba, and they would tell me that they had kids, they have family, and if they didn't have correct thoughts, if they didn't stop questioning that it wasn't just their lives at risk, it was whether their kids would get medical treatment in the future. And of course, there's a community there that will talk to each other. And once you are blacklisted, there's no telling when you can come back online to get medical treatment. That's why in communist countries, the need to control their population is so great. And they need only two things. One was, of course, food. And then they
Mhm.
did. They took over the plantation. It didn't matter if the political hacks that took it over didn't know how to grow anything like sugarcane. It didn't matter. That what mattered was that they controlled it. Fidel Castro himself, I don't know if you knew this, but when he took over power, his family had a plantation, had it for 80 years. His sister and his brothers and his mother had control of the plantation with many workers. He went in a Jeep along with troops, and they seized control of the family plantation and removed his family. His sister is currently in Miami, never saw her brother again, but they took over, and that is because the state overruled everything, including family, including God. And the second thing, of course, they did was to take over the medical industry. And you have yahoos like Sean Penn and other morons like Michael Moore going to Cuba and just praising it to high heaven. But what they don't talk about is that that was an absolute weapon to control the population because the doctors worked for the government. and the doctors were that whatever science that the government said was the science was the science, and you better not question it. So that's why it was a shock to me when I saw all of this play out just like that, a recreation of what was happening in Cuba. And right now, I think it's so important. We don't know what's going to happen in the midterms, but it's so important to attack that system that will attack and control hospitals and doctors. And I don't know if is that something that can be done? Is there something that is being done about that?
Well, you have to understand the history behind that. So when Obamacare came in, it was really targeting the private practice doctor. All right. And all of the regulations that came with Obamacare were so cumbersome that the small doctor could not financially maintain a private practice. And so at that point, the hospital systems came in and they bought up all the private practices. And it was, you get to keep your private practice, but we're just going to help you with the overhead. Well, it never works like that. And what happened is that the hospitals literally own the doctors, and the hospital systems say what you can do and what you cannot do. All right. And so this is, it was just the laying the groundwork for what happened during COVID. We also had, with the move away from private practice, we also had the hospitalist movement. And this is doctors who work a shift in the hospital, and they may work, 3 or 4 shifts in a row, but we lost the continuity of care because you could actually be a patient in the hospital and have a different doctor see you every single day of your hospitalization. And when there was a private practice covering, there was generally one doctor who would see you throughout the time that you were in the hospital. And that has completely disappeared. And there's also not a connection between your outpatient doctor and the person who treats you in the hospital. So if you were in the old days, it would be a doctor that was part of the practice. And so there was an accountability. All right. So not only to the other doctors in the practice, but you as a patient within that practice. And so all of those mechanisms to hold doctors accountable and to have checks and balances so that if your primary care doctor was not doing rounds, he had the ability to make a phone call and say, I'm really confused about the patient. Can you tell me more? All right. But the hospitalist has no motivation to call the primary care. They're there just to treat your problem and just make sure that you only have one problem when you go into the hospital. All right. They don't, and this is really hard as patients age, their medical conditions become more complex. And yet the hospital system is narrowing the problems that they're going to focus on. And that often places the patient at increased risk. All right. So you could go into the hospital with an infection of your toe, but because you have diabetes, that places you at risk for other things. And we want to make sure that the hospital is looking at all the risks that are associated with infection and diabetes. And if your diabetes gets out of control, what effect does that have on your cardiac and your renal function? So your heart and your kidney function, those are both impacted. So unless you're looking at the entire patient and invested in making the entire patient well, you're at risk. And this is what we want. We want to return the medical system to treating the entire patient and giving the patients the tools that they need in order to get well and to stay well.
Well, a lot of the doctors that were independent private practices, I would guess that a lot of them would want to return to that. They could. It was the coding that, at the expense of the coding, that drove them to having to become into that industrial complex. Is there
Yes.
some way we could reverse that?
Well, I would like Obamacare to be reversed. I think that the coding was done in order to track things. All right. And it wasn't for the benefit of the doctors. All right. It was for the benefit of billing companies. All right. And the codes are very cumbersome. And even with COVID-19, we're just now getting codes related to vaccine injury.
Mhm.
All right. Um, we're getting codes related to syndromes after having COVID that you haven't recovered from. But again, they don't fully encompass the degree of injury that has occurred because of the COVID-19 shot or because of the illness. And so I think it limits us, but it also increases the total cost of the healthcare system. And I think if we got rid of the coding system and we could really provide much more care to the patient rather than spending all of our time on coding and documentation for those billing codes.
I know that I mean, this is such a like a transition time. It's like the timing of the coding and the explosion of the cost for private practices, and then that took like a few years, and then doctors made some tough decisions to go and work with or affiliate with the major hospitals, and then just as soon as they were just getting comfortable in that corporate seat, the Chinese Wuhan virus hits and everything explodes. And so the cage was made, and then the cage shut down, came down on everything. And the system was exposed for all to see. So now we see like the Death Star. The Death Star has now become activated. We know what it does. We know what
Yeah.
it can do. And we know the threat it holds for all of us. So decomposing that would be the ideal thing. And then while we're talking about that, in a way, the threat of AI comes in, where the diagnosis, more and more of the parameters of the pathologies being entered into this system. Hopefully, it's an accurate system, and doctors more and more are relying on the solutions and the remedies through the AI system, which further dehumanizes the whole medical practice.
Correct. And AI can be helpful if we want AI, good AI to be helpful. But one of the risks is, and there was recently um, two doctors created a fake disease and they put together two papers, submitted them, and put them out online. And AI very rapidly picked them up and they began those completely fictitious journal articles were then picked up and cited within 2 weeks in other journals. All right. And so doctors have to be able to discern and not simply ask questions. Because even when I've gone on AI, I have to ask very specific questions. Where did you get that answer? I'm looking for the journal articles. I'm reading the journal articles. All right. But if you're just asking a simple question, differential diagnosis in a patient, will it give you the full differential? All right. Or will it get it's information from Reddit. All right. And the reason I say that is because there was an expert in guitars who took on AI. And when AI failed to answer correctly, it asked it, where did you get your information to make that decision or draw that conclusion? And AI revealed it was from a review of Reddit. So we really need to understand where AI is getting its information. And it's only as good as the correct information it's fed. So, as we've seen over the last 6 years, the tremendous conflict in medicine. So, we have the people who are continuing to say that the mRNA vaccine or shot, the gene therapy shot, is safe and effective, where there's overwhelming evidence that it is very far from safe and it is not effective at all, right? And so, where is their source of information and where is the counterbalance to that?
Mhm.
And I really think that people have to start using their brains again, right? That we have to think, we have to reason, we have to look look outside the box. And one of the things I like about the field of medicine is that patients don't present in the same way. And so if they don't present in the same way, then my intervention can't be robotic. I have to look at the patient and truly understand them. And for them, what is the best intervention rather than saying it's one size fits all.
I know that's the temptation. The temptation I could just see with doctors that have lots of patients. The temptation would just go to by rote to the AI device and to just go ahead and feed them this information. And and they that's the information that the AI is gathering may be coming from faulty sites. That's one thing. Then you have to worry about hallucinations. Now, who would ever think of coming up with an idea that AI will have hallucinations? But they have seen time and time and time again, completely incorrect, erroneous information that is not even based on the information pool that it's feeding it. So what they're doing is they're calling it a hallucination, which is AI comes up with a conclusion that's completely separated from the information factual pool, which is very disturbing. So so it's always like the idea, even though it's going to take some time, is that you always have to subjugate AI as a device that helps you, but you ultimately have to follow up on it. I know that takes time,
Yeah.
but some of these diagnoses, if they can make mistakes on real basic informational issues, imagine how much more easy and complex issues of diagnosis that AI may be faulty.
And we also have to look at medical ethics, all right? And that the integrity of the human being and the infinite value of the human being. And how often will AI say, this patient should be put on, based on their diagnosis, should have limited treatment interventions? Okay. And so that the AI is making a decision about the treatment pathway that a patient may have, and they could make that simply based on age, right? And so we know that, um, part of the Zeke Emanuel, who wrote Obamacare, didn't think you should live beyond 75.
Yes.
And so is AI going to then step in and say, well, you have a chronic illness. We think that treatment options should be limited based on your age and your medical conditions. All right. And I think that's both at the end of life and at the beginning of life.
Yes.
All right. And we're having a crisis. And are is the intervention going to be, if you have a complex pregnancy, is the intervention going to be a recommendation of abortion rather than a delivery of the child and protection of the child for as long as it can live if it's going to die? Or are we going to opt for abortion rather than an emergency C-section in order to attempt to save both the mother and the child?
Yes. And that's the danger because the tech bros at Silicon Valley they're the ones that are feeding and developing these AI systems. It's if we had the AI systems back in 2022 and we asked, oh, what do you do about the COVID virus? The answer may actually be the same now, depending.
Yeah.
You look at Wikipedia, what Wikipedia used to be the go-to until we were finding that the people feeding in the information had an agenda and a worldview that was at odds with sometimes reality. So now
Yes.
Wikipedia is not considered the go-to as much. AI may be in that same category because you're right. I can imagine whoever's feeding that information in Canada,
Yes.
they're asking about this person who's depressed,
Mhm.
22 years old. They may opt for death. Yep,
Yes.
death, because that's what's happening. It's legal there. They have a word for it, euphemism, but
Yeah, medical assistance in dying,
yeah,
and it's a very real thing, and we're really grateful that we had 2 Democrats who flipped their vote, and it did not pass in the General Assembly this year, and we hope that it will have a year off, but I imagine it will come back again in 2027. But it's really important to look at how it's being used in other countries, in particular for the mentally ill and the disabled. And one of the reasons that they target those groups is they also want to harvest their organs. All right. So these are otherwise healthy individuals who have mental illness, who are poor. Poor is one of the reasons that you can be euthanized in Canada. And so this allows the medical establishment to step in and say, okay, we're going to assist your death, and then we're going to take your organs to see how we can best use them. So there is ulterior motives of the very a sinister nature. So this is not an altruistic means to help people at the end of the life. It is very sinister.
it is. And there's a financial reward component
Yes.
to this, just like there was under COVID. There was financially, it was in the interest to diagnose everything under the sun as COVID and to say, oh, and this is like committing medical fraud, that if the death was in a car accident, they died of the collision, but there's a chance that they might have had COVID, then on the death certificate, they would have put down death by COVID because that meant they would have gotten a $35,000 bonus, which I'm not sure how that's possible, but that's actually what was happening. So this is a systemic thing that will corrupt and will tempt, practices that need the income. And I hope that that's something that they look into, because that you can't, it is very easy to corrupt people. And the one thing that you want to avoid government and institutions corrupting medical practices. That should be free of that kind of temptation and corruption.
Correct. And I think in terms of organ harvesting, um, Robert F. Kennedy just shut down a facility out of Kentucky where they were trying to harvest the organs of a man who was alive. And he was fighting the surgeons. And so it is those types of things. It used to be that there was no or that there was limited contact between the team that decided that the patient was brain dead. And we really need to reevaluate what brain death means. Because if your heart is still beating and you are still breathing independently, are you truly brain dead? All right. And are you in a coma that actually can be reversed? And so there's many questions around the term brain death. And brain death was invented, the term brain death was purely for organ harvesting. All right. And so we now have plenty of evidence that this is being misused and manipulated, not only in Canada, but in the United States, and that we want uh, the teams to be completely separate. The team that declares a patient is dead versus the team that does the organ harvesting. But there has become a blurring of that in the hospital system, and that needs to end. But above that, we need to re examine the entire concept of brain death.
That's going to be a very difficult thing, because the brain's so
Mhm.
plastic, and the technologies now, especially with AI breaking down all these barriers. God, what we say today about brain death could be completely reversed by tomorrow. But that's the thing about science that I guess they forgot under Fauci, that the whole point of science is to be able to question and
Yes.
validate.
And I think for patients in persistent vegetative comas, for patients in comas, I think that the use of red light therapy and other interventions that detox the body, that bring down inflammation, that I think that there are potentially therapies that may help with this and may help people recover. We know that um, infrared light, red light therapy is helpful in concussion, stroke, Alzheimer's disease. And the more that we see this, why can't we, extend that to the ICU and see what can happen there?
Yeah, that exposure to red light, I guess, because it can go so deep into the tissues, it can affect the mitochondria and
Right.
we produce all kinds of positive outcomes.
Absolutely.
Interesting. So this conference is looks like it's really action packed. I mean, it's just like a lot of good content, and then even you're optimistic because I know you are that people after all of that, just all that content intensity, that they can just dance away the troubles on the dance floor and have a nice dinner. So that sounds like a really complete day. Just packed into. Is it all one day or is it over 2 days?
It's all one day. So it'll be a full day. But I think the thing to keep in mind is that you can go and come. All right. So if you need to relax, you can go outside for a little bit and then come back in. The entire event will be recorded. So that's important. And then a really important element is Gary Porter, who's retired military, will be talking about the interface between the Constitution and medical freedom.
Ooh, that sounds
Right?
great. That sounds really great. So, and you don't have to miss any of these things because there's no like breakout sessions where you have to say, "Oh God, these two speakers are great. I have to pick one or the other." Right? You can.
Correct.
Okay, good, good.
So you don't miss anything. And if you need to take a break, know that it's being recorded and you will have access to the recordings.
Okay, so if they wanted to, where do we direct them? I'm sure we're going to have a link, but just go ahead and just say it now. How do they get tickets? How do they find out about?
So you get tickets on our website, which is VAMFA.org. All right. And on the very landing page, it'll say more information or tickets, and you just click on that button. Tickets are $75 for the day and $75 for the evening. So $150 for a full day is a real deal. Particularly for the level of speakers that we will have for this event. And again, you have the opportunity to talk to the doctors. You have the opportunity to speak with every single presenter. And that's what it really makes these conferences. And many people have come to the conferences and afterward they come up to me and they're often in tears and they say, "I thought I was all alone." And this is a place where you can really network with the people at your table, but network with people across the state. That people really are welcoming. And this is an opportunity for everyone to share their story. I think one of the things that we're going to do that's unique in this conference is we're going to ask people who have been injured by COVID, injured by the vaccine, either the COVID shot or other childhood shots, to tell their story. And we're going to record those so that we can publish those so that people understand that vaccine injury is real and how they've gotten help.
Okay, so some of the I guess some of the issues that we kind of dodged and fought this year is going to come up next year, and I guess some of that, what we can do in the state. So a lot of times people are like, "Oh, I can't. It's just too much doom and gloom," and because they've sat through some of these conferences, and what happens is they're hit with all of this really dreadful information, and then the speaker leaves, and they're like, "We can't do anything about it." But in this case, as it always has been the case, there are solutions, viable solutions, where we can actually succeed in turning back some of this dark stuff.
Absolutely. And I think one of the wonderful things is being able to talk to the experts directly. That is very rarely something that you can do at a conference. And additionally, we have built a network so that you can get for people interested in vaccine exemptions, so religious or medical exemptions. We have a whole network that works and assists families with that. So we have, naturopathic doctors as well as regular physicians who are doing things, and you have access to them. All right. And they look forward to that because they understand how disconnected the medical community can be at times. And so your ability to sit and talk with them. One of the things we've had at one of our past conferences is Ask a Nurse. All right. And that was a hit. So we're going to bring that as well as Ask the Doctor. So our maternal-fetal specialist will be at a table for everyone to ask him questions directly.
Oh, that sounds like a very full day, very positive, which is good.
Yeah.
And empowering because knowledge is powerful. So September 12th this year, Founders Inn, Virginia Beach. And it sounds like a really good thing. And of course, just to let you know, speaking of not being alone, we are all natural allies. We have been for many years now. And we have other groups that also are natural allies. And the steamroll of the left or the bad guys seem like it's that they can't lose. But I'm telling you, the backlash will come. But the important thing is the backlash has to be based on information that's accurate, that counters the negative or the false information. That's where these conferences come in. That's why speaking to the experts actually empowers us to be able to go back home or go to our churches and speak truth to them that they can verify. That's where the backlash comes. And if that happens, we can get back our state. So
absolutely.
Isn't that great? So any last words, parting shots, Sheila?
This is what we want you to do is buy your tickets now. If we sell out by August 31st, which is our goal, we're going to try to open additional space, but we have to be sold out by the 31st. Otherwise, we can't open additional space. So it's really important that people buy their tickets as soon as possible. We want a full house and we want the hotel to open up more room, but we can't do that unless we're sold out.
Yeah. And I think this is a real important for all of us because the left found out the power that they had in order to shut down an economy and an entire people, a people that was born in freedom, have a legacy of freedom and liberty. And so that consequence for that has never come to pass yet. It never has come to pass. And so the people that actually impose that on us are still operating and in positions of power, And so in light of that, I think it's important for all of us, for the people who are watching this is one of these conferences that you really should strongly consider for your family and for the future of this country. Because one thing we cannot allow the government to take over our medical community, just like we cannot allow them to take over our farms. These are the two things that are no-nos. Do not pass, do not collect 200, do not pass go. That's the kind of thing. And this is life and death. So this is if you're going to get to any conference, this will be the one to come to. Right, Sheila?
Right. Absolutely. And if you can't attend and you want to donate towards somebody who can't afford to come, please do that. You can donate on our website and we will use that. You can purchase a ticket for somebody else. All right. And we have that every year. People call and say, I'm not able to come, but I'm going to buy a ticket. And whoever calls me and says, I can't afford this, we try to get them in. Mm-hmm. So, we really want to work with the community and we want people to have access to this material in this wonderful day.
Yes. This was a wonderful, wonderful interview. I'm glad we were able to get together. Always have fun. Actually,
Yeah, we do.
that's the trick, isn't it? You're talking about all these dark things, selling organs and all that stuff, but we also actually can have you know, the thing about it is good people need to have good spirits and to be, keep their humor and their humanity. That's always the key. And I suspect at this conference, you'll be able to keep all of that and more. So,
Yes.
so for Sheila Furey, Dr. Sheila Furey, and myself, I'm glad you joined us for this splash of tea, and I hope we will see you on September 12th at Founders Inn for this very important and pivotal consequential conference.